Good morning. Thank you for taking your time to join me. I'm very pleased today to announce the activation of the Southeast Regional Pilot Acute Stroke System. This system is based off of one that has been operational in the Birmingham Regional Emergency Medical Services area for a number of years. This is important because stroke is the leading cause of serious long-term disability and is the fourth leading cause of death in the United States. In Alabama, stroke kills more than 2,500 Alabamians. Individuals who have a stroke need to be evaluated rapidly. Time saves brain. So getting people to a location where they can get definitive therapy early will reduce long-term disability and save lives. Just like for trauma, this is a voluntary system of hospitals in Southeast Alabama, where hospitals will be able to determine their ability to take stroke patients. Patients will be routed to the closest available center capable of providing them care that they need. We'll be constantly monitoring this system to ensure that the quality of care is excellent. We have already inspected all of these hospitals and designated them for the level of services they can provide. And again, each hospital will determine, based upon its current capability in real time, whether or not it has the capacity to take care of a stroke patient. This is a pilot. We'll be evaluating this pilot, and if it is successful, as we anticipate it being, we will then proceed statewide to roll out a stroke system to mirror the trauma system that's in place in most of Alabama. I want to thank the hospitals in Southeast Alabama. Let me thank the Alabama Trauma Communication Center for being the routing entity for this system, and for all of our partners who've been working to provide access to care, minimizing death and disability. Again, the reason that this is so important is that the most common type of stroke is a clot. And often, individuals identified early can have the stroke completely reversed by use of a clot busting medication. Time, however, is critically important. Usually this treatment must be started within a few hours of the onset of symptoms to be effective. By setting up this system, we maximize the opportunity for people to be transported to a nearby hospital with the capacity of providing this life-saving treatment. Let me next turn it over to Dr. Nafziger, who is the Stroke EMS Medical Director. Sarah?
Thank you. I am the Assistant State EMS Medical Director, and on behalf of Dr. Elwin Crawford, who is our EMS Medical Director for the state, I want to thank you for being here. As Dr. Williamson mentioned, stroke is the fourth leading cause of death in the United States, and here in Alabama it's actually the third leading cause of death. I would dare say that every Alabamian has a friend or a loved one who's been affected by the devastating aftermath of stroke. Early in my career, I really thought that stroke was a disease of the elderly, but what we've learned is that stroke affects people of all ages. And because of this, that's why we have worked together to put together this system that identifies stroke patients in the pre-hospital setting and gets those patients to the closest available hospital that can provide the appropriate diagnosis and treatment for stroke in the very narrow time period that we have to affect stroke. Thank you for being here today, and now I will turn comments over to Dr. John Campbell.
Thank you. Our experience with the trauma system, where we have dropped the highway death rate in Alabama by about 36% within a couple of years of getting it almost completely over the state, we think we can do better than that with stroke. About 90% of strokes theoretically could be treated with this clot-busting drug. But right now, only about 10% are getting treated because people procrastinate when they have symptoms, weakness or difficulty speaking or numbness. They wait to see if it's going to go away. They call their doctor or go to their doctor. They need to call 911 and come in immediately. The first 2 hours are the critical thing. And if we can get people in, we can have a better effect even on stroke than we've had with trauma. So the key to making this system work, we've got the system and we know it works. We've just got to get the public to understand to come immediately, to call 911 so they can get to a place where we can save their lives or save a disability. Thank you. I'm going to have Dr. Suggs is our champion. He's a neurologist, and he has really had a great deal to do with making this work.
This is a great day for stroke care in our region and a wonderful step forward for stroke care in the entire state. Stroke, as Dr. Campbell has mentioned, is a very time-sensitive treatment, and we have to get folks to the hospital quickly. And this system will allow patients to get to the closest hospital that has the resources available to treat their stroke. And it's a really wonderful integration of telemedicine and local neurologists and emergency room physicians and EMS personnel coming together to affect the best outcomes for the patient. The main thing, though, is for you to recognize the symptoms and call 911 and activate the EMS system. That's the best way to affect a good outcome. You should not, on your own, drive to the hospital or wait and call some other folks about it. You need to call 911. Again, as a stroke practitioner over the last 20 years, this is one of the greatest achievements that we've had, giving TPA and now getting patients to the hospitals that they need to be at. Thank you.
Thanks, Dr. Suggs. Systems like this don't develop without somebody locally who serves as a champion, and Dr. Suggs has been that champion locally, and we are extraordinarily grateful for that. Let me give you a little bit of an idea of the geographic span of this new system. It'll cover counties from Covington County all the way over to the Wiregrass to Dothan. It'll come up to Montgomery and to I believe Autauga County. The bottom line is this brings in 18 counties in southeast Alabama. And it gives us now the opportunity to make a real impact on a major cause of death and disability in Alabama. So with that, let me stop, and I will take questions. Okay. Well, again, beginning today, this system goes active. Patients will be able to be routed to a hospital when they have an ischemic brain event. They'll be able to be routed to a hospital that has the capacity to provide them the care they need, going to the quickest hospital to provide that care, thereby maximizing their chance for survival. Joe?
Could one of the astute doctors give us the signs and symptoms of stroke?
Dr. Suggs, you want to cover those?
Well, several things can happen. First of all, we use the FAST scale with face, arm, and speech and time. And whether you have weakness on one side or the other, visual changes, numbness and tingling on one side or the other would be the most common. And they're of sudden onset. So symptoms that have been going on for a week or so would probably not qualify. But if you had sudden onset of one-sided numbness or weakness, half your vision going out, those kinds of things would need to be what we would look at.
Okay. Any questions? If not, thank you. John, thank you. Up and running.